I think beauty is definitely from the inside. I think when people have that internally, it shows through in their face and their personality. And I think those things are very beautiful. I think when people smile and they have that confidence, it's beautiful. And so I think what I like to do is just help with that confidence and help bring that out a little bit more because when people are confident and they smile, it's beautiful.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Jennifer Jaeger, a registered nurse in Billings, Montana, with over 25 years of experience caring for patients in various settings. She began her career in emergency nursing, where she thrived on the intensity and teamwork. However, after the birth of her twin daughters, one of whom sustained a severe birth injury, she transitioned to full-time caregiving for her while taking on contract work in hospice and home health. After her daughter's passing a few years ago, she returned to hospital nursing, but felt a strong pull towards a different type of care. This led her to explore IV vitamin therapy and hyperbaric oxygen treatment. A pivotal trip and a meeting with another med spa owner introduced her to aesthetics nursing, which immediately resonated with her. Today, she's the proud owner of Amore Aesthetics, a med spa dedicated to empowering individuals to feel confident, supported, and beautiful in their own skin. So Jennifer, welcome and glad to have you here.
Thank you. Thank you for having me.
Yes, let's dive right into it. Let's start with this. What first got you interested in the medical field?
So I actually, when I was about 19 years old, I had an ovarian cyst that had to come out, and I was just super fascinated with all of it.
Mm-hmm.
So yeah, I was fascinated with the science behind it and just what our bodies can do, and the surgical process, just all of it. So that kind of sparked my interest, and I decided to go to school and yeah, the rest is kind of history, but I have loved all of it. So
Okay.
haven't had a day where I regretted making the decision to go into nursing.
That's good. That's good because I know some people go start getting into one path and then they switch to another path and switch to another path, but it sounds like you stuck with it and you've enjoyed medicine the entire time.
I have, yeah.
Now, I want to talk a little bit about this transition you went through and the heartbreaking loss of your daughter. Like I'm sure that played a huge role in kind of where you ended up right now. So throughout that period, like that transition, like in the introduction, you got introduced to you want to look for a different kind of care, so that you start looking at IV therapy, hyperbaric oxygen treatment, talking with other practice owners. So what was it about that you want to look for a different type of care? Like, was it like what part of that led you up to that point? You want to look for something different.
So yeah, when she first passed, I was really used to being busy 24/7, and I didn't know what to do with myself. So I just jumped right back into hospital nursing right away. And I still liked it, but I didn't love it.
Mm-hmm.
And there were a lot of changes, I feel like, since I was last in the hospital setting, especially after COVID. A lot of things were just different.
Mm-hmm.
And I had patients that reminded me of my daughter and were very triggering. And it was just a variety of things. I was just like, I'm not loving this. And so I was just kind of looking for something different. And the IV infusions and vitamins I had been interested in. I'd done them before, and I thought, I think this would be fun. So I kind of started searching in that direction and took a job, and I really liked it. I loved that I got to spend time with patients. I wasn't just moving as fast as I could, task to task to task, and not getting to sit down and
Mm-hmm.
really get to know a patient. And so that was something different that I really enjoyed. I felt like I was helping people on the other side of illness and doing more preventative type of care. And yeah, I loved it.
Mm-hmm.
So that's kind of how that happened.
Okay. And I've heard people that have gone down a similar path as you, like going to hospital, then going off on their own. A big change was that when they're in the hospital, they're typically dealing with sad or angry people. When they start their own practice, they're dealing with happy people most of the time. Was that
Yeah,
kind of a
yeah,
similar experience for you?
yeah, yeah. I don't know. I don't like human behavior when people are sick. It's all different, and you kind of have to put it in perspective and know that this is circumstances and give people a little bit of grace. So that kind of stuff didn't bother me a whole lot. It was just, I think I didn't like that I wasn't getting an opportunity to spend any time with people that
Mm,
I was caring for. It was just getting things done.
I see. And so,
So
yeah. So then what led you to open up a more aesthetics? I mean, why set up your own practice? Why not just work for another practice?
So last year I went to visit my sister in Arizona, and she has a friend who has her own med spa. And I went in to have some services done and got to visiting with her about all of it. And it just like I just thought, oh, I like the idea of this.
Mm,
I think this is what I'm drawn to, and this would be a
mm,
lot of fun. And so I started taking classes and getting certified in multiple areas of aesthetics. And there just isn't a lot of job opportunities for somebody that's new in aesthetics. People want to hire people that have experience. And so I did some job shadowing and put a lot of a thought into it and just decided I'm just going to do it.
well,
Yeah,
there
I'm
you
just
go.
gonna.
That's all
So
you need.
yeah. So I kind of just dove in. It took a lot of really hard work, a lot of sleepless nights, and a lot of research. And yeah, I don't regret it. It's been fun and it's rewarding, and yeah,
Awesome.
I'm happy with my choices.
That's good. That's good. So now that you have this practice, what are some of the common treatments that you provide to your clients and your patients?
Um, kind of a variety of things. I've done lots of Botox is probably one of the number one.
Hmm.
And lots of microneedling and PRP treatments would probably be
Hmm.
my top.
Hmm.
I do fillers too, but that doesn't seem to uh be up there as
Hmm.
much as like the Botox and the PRP and microneedling.
Okay.
So
So for people who are not aware of PRP, what is PRP?
it's platelet-rich plasma. And so blood is drawn. It is placed in a centrifuge and spun down to separate the red cells from the plasma. And then you draw the plasma off and you spin it again, and the platelets become the uh, the heaviest cell in the tube,
Mhm.
and that's what's at the bottom, and that's what you draw off and inject.
Okay. And what
So,
are the benefits of doing that?
so it has a lot of growth factors in it,
Hmm.
and it also stimulates stem cells to come to the area where you inject. It brightens the skin, it tightens the skin. It's great for pain management as well. I've done a lot of PRP for pain management. So far, golfers are my top,
Hmm.
the
Okay.
top people for elbows. Yeah. Yeah. So,
Okay. So it's really using the body's own, I'll call it materials, I guess, to reheal and to not just get rid of pain, but also improve the skin quality, texture, tightening
yeah.
it.
Yep. Yeah.
Okay, got it. So,
Absolutely.
and is it really the same process whether it's for like improving skin collagen, tightening, like just for like the skin part of it and pain, or is it different modalities of how they're spinning it or how they're processing it or whatever they're doing
The
with
process
the
is the
body?
same. You spin
Yeah.
it and you draw it
Mhm.
the same. It just depends on where you want to place it and what your goals are. So
Mhm.
yeah, skin, it's going to help promote collagen and elastin. That's going to help tighten, but it also gives the face a glow.
Mhm.
But you're going in to the subdermis
Mhm.
area with the PRP. You're injecting into muscle or joint, it just is going to function a little bit differently.
Okay. So it sounds like it's almost like a cure-all, almost like you can use it either for the skin, you can use it for pain, you can put it in the joints. Like if it's the same way that you're pulling it out, it's almost like a I don't know if panacea is the right word for it, but like it can fix a whole lot of different things, even though it's the exact same thing. Is that kind of the right understanding of it?
Yeah, yep, 100%. Yeah.
Oh, okay.
So, and it's your body's own platelets. So it's,
Mhm.
yeah, it's safe and it's very effective.
Okay. So if you're using it for the skin side, do you have to apply it using something like microneedling, or are there different ways to apply it? Or is microneedling just one of the ways to apply it?
Microneedling is one of the ways to apply it. I also inject it. I'll inject it into areas of the skin that maybe have a little more laxity,
Mm-hmm.
or under the eyes, just to give it a little extra boost there, and then microneedle the rest into the skin. So I've also used it for hair loss. It helps um, dormant hair follicles kind of come to life again.
Oh
And
man.
so, yeah,
Okay. So it's going back to that one for everything. You use it
yeah,
for skin, use it
yeah,
for hair growth, use it for pain. Sounds like you can use it for a whole lot of things.
yeah,
Um,
yeah.
okay, so then when it comes to, let's say, just on the face and the skin, um, you said it's kind of for brightening, it's for tightening. Is there any specific age that it's really going to give you like a better effect for, or doesn't it really matter, or you just tend to see like older or younger? Or like, is there something that comes into it with age as far as the treatment goes?
You know, what matters is platelet levels. If you
Mm,
have a low platelet level, you're not going to probably get a good amount of concentrated platelets
mhm.
to make a big difference to really move the needle. And so that's kind of your determining factor, is
Okay.
what your platelet levels are.
Okay. And is platelet level something that typically goes down with age, or you kind of
It can
maintain
go
it?
down with age, it can go down with illness. So
Mm, okay. So normally when you do, if someone's looking to get PRP done, do you measure their platelet levels first and kind of figure out, oh, like, hey, you have low platelet levels, it may not work as well, or it's like, oh, you have a really, really high ones, you should do really well, or how does that part work?
you know, I wouldn't test um platelets myself, but if I had somebody that I was concerned about, I would have them get their most recent um lab results so that I could see and just know that yeah, I'm not going to charge you X amount of
Mm,
dollars for
mm.
something I don't believe is going to be
Okay.
beneficial.
Okay, got it. And so age doesn't really matter. It's more the platelet levels is what really people should look at more of.
Yeah.
Okay, got it. And is it painful? I guess that's a question you get from people quite often. I would imagine. Is this the whole thing painful?
Yeah, the microneedling's not too bad. You can put numbing cream on and that pretty much takes care of that.
Mhm.
Injecting it is pretty uncomfortable.
Mm.
So
What about
yeah.
pulling it out?
Oh, that's just a blood draw.
Okay.
Yeah, that's nothing.
I'm sure. Oh wow. I'm sure. Well, I'm sure you still get people. It's like, oh man, like I don't like needles. Like don't draw
Yeah,
my blood.
yeah, yeah, yeah.
Okay. So when it comes to this treatment, what are some common misconceptions that you get from your clients that when you talk about this treatment?
I think probably the biggest thing is that it's a time commitment. So you're not going to leave looking tight and brand new. It's
Mm-hmm.
something that you need to repeat a few times, spaced out about 4 weeks apart, and you just have to give it the time to work.
Okay. And that's a great question then. So how many times do they typically have to do it? Is it depend like if you're just doing on the face versus doing the hair growth versus doing the pain reduction? Like how many sessions could the average person expect?
So for skin and hair, um, what typically I do is 3 sessions spaced 4 to 6 weeks apart.
Hmm.
And then they'll come in and we'll follow up and reevaluate. And if no more is needed at that time, then we'll follow up again in 6 months and 12 months.
Mm.
But typically you would want to repeat that every 12 months just to maintain.
Okay. So it's not too bad. A couple treatments, and then after that, you just want to keep an eye on it then.
Yep, maintenance. Yep.
Okay, got it. Any other misconceptions that you can think about that you get most often from your clients on this?
I don't know if it's more like people don't want to take care of their skin in
Mm.
between and do the
Oh,
thing, in
yeah.
between. So
Hmm.
I don't know if that's a misconception, but maybe they don't understand, or I don't
So
know
this is not like a
what the
silver bullet. You still need to do other
you
things to
still need to do other things.
improve your
Like you still
skin.
need to feed your body healthy foods. You still need to
Mm.
take care of not smoke and do
Yeah.
those things. You really need to have good skincare, good quality skincare just to
Mm.
maintain everything. And so I tell people, it's a big investment
Hmm.
to do the microneedling and the PRP and all of that. It's a big investment. Um, that's not comfortable
Yeah.
and it's a time commitment.
Hmm.
And so you really need to make sure you are taking care and maintaining what you just invested in.
Mm, okay, got it. Now, you mentioned before, I do want to go back to that typically on average can be maybe 3 treatments, and then after that it's gonna be maintenance. Are you basically drawing the blood and spinning it every single time they come in, or do you take pretty much all the blood you need in the beginning, take the blood, spin it, and then you kind of keep it until their next session?
No, no, you have to redraw.
Redraw. Okay, so
Redraw.
basically you have to
Yeah,
you have
those
to draw.
platelets aren't going to be good for that long. They're only good for
Ah,
about 4 hours.
oh
So yeah,
wow. Okay, so you gotta do
yeah,
it pretty quick then.
you got to do it pretty quick. Yeah.
Okay, good to know. Now, okay, so then Jennifer, let's say that somebody is looking for this type of treatment, and but they're looking for a provider who can really do the best job for them, really make them comfortable, and really help them get the results. What would be the most important piece of advice you would give to someone like that as they're doing their search for a provider?
I would I would talk to people. I would ask other people that have had it done,
Mm,
um, what their experiences are with their providers, but also just making sure you ask questions. So, like I said, how do you draw? You want to make sure you're
mm,
getting a double spin.
mm,
And also somebody that's going to sit down with you, listen to what your goals are. Um, make sure you're getting a full consultation,
mhm,
make sure you're getting all of your options and kind of making sure you're the one that's in charge of how things go.
mm.
Um,
Are there
you
any
want
red
somebody
flags that they should keep an eye out for?
who, I'm not sure. I'm sure there are. I can't think of any. Um, I would just, yeah, I would just want somebody that can answer my questions.
Mhm,
Um, Somebody that is going to put me at ease
mhm,
and somebody that's certified that knows what they're doing. So I think the biggest thing is just to make sure you're asking questions of your provider to make
mm.
sure that they're a good fit for you.
Okay, good to know then. Now, Jennifer, I'm curious, how important do you think having an artistic eye is in how you treat your or how you approach patient care?
I think it's very important.
Mm,
Yeah, I think it's very important. I think that people come in and they just want, there are these little lines here taken
mhm,
care of or their forehead taken care of. But you really have to look at the whole face and the whole person and evaluate from different expressions and perspectives and formulate a plan. And like I said, give people options, give them all the information and then let them choose.
mhm. Okay. Okay. Now, uh, I'm sure that Jennifer, that you've had some challenging cases or tough cases, or at least memorable cases of clients that you've worked with. Is there maybe one story that you could share of just, again, memorable case, tough case, challenging case, and how you were able to get them a great outcome in the end?
Um, so probably the one that sticks out in my mind the most is I had a gal come in and she basically wanted a facelift. She's
Mm,
in her 50s. She wasn't happy about how her face was starting to fall down and she was getting these nasolabial folds were starting to deepen and she had the marionette lines and all the things. And so we sat down and we talked about all the different ways we could accomplish her goals. And at the end, we spent about 3 hours together, and it was so fun. But we Botoxed full face and neck. We did cheek filler, lip filler under the eyes, and it was just a beautiful transformation. That's probably been my favorite one so far. It
wow.
just really was transformative and
Yeah.
beautiful, and yeah, and it was a lot of fun. But it's definitely artistic.
Mhm.
Yeah,
need to have that artistic eye.
yeah, it's fun. It's a lot of
Okay.
fun.
Okay. And now, Jennifer, where do you think the future of aesthetics is going?
You know, I don't know. I think people are maybe wanting more natural ways,
Mm,
and natural looking. People are kind of tired of the overfilled look and are wanting more subtle, natural things. That's
mhm,
something that I'm really interested myself in learning about, is utilizing PRP
mhm,
as filler, but just trying to do things a little more naturally.
mhm. Okay. And for you, what's your vision for your practice and more aesthetics?
Um, that's a hard question because I've only been open for a short amount of time.
Mhm,
But I definitely would like to see some growth. I'd like to be able to add some things to my practice. But I'm really happy right now with just me.
mm,
And being a one-man show,
mhm,
I'm really, really enjoying it. So I don't think I would want to take that out of the equation, but I would like to see or be able to add to my
mm.
practice.
Okay.
I think maybe a little more school may be involved
Mhm, mhm.
so that I can offer some more.
Yeah.
But yeah, I'm happy with where things are at right now.
Okay. That's good. Well, then, Jennifer, I have one last question for you, but before I ask it, I do want to point people to your website at amoreaestheticsmt.com.
Yes.
Now, last question is, what does beauty mean to you?
I think beauty is definitely from the inside. I think when people have that internally, it shows through in their face and their personality. And I think those things are very beautiful. I think when people smile and they have that confidence, it's beautiful. And so I think what I like to do is just help with that confidence and help bring that out a little bit more because when people are confident and they smile, it's beautiful.
Hmm. Well, there you have it. Jennifer sharing her expertise. So,
Yeah.
Jennifer, where can people contact you in your practice?
You can reach me at 406-500-8172. And you can also reach me at hello@amoreaestheticsmt.com.
Awesome. Well, Jennifer, this is great. A lot of fun. Thank you for coming on and thanks for sharing your message.
Thank you for having me. It was really nice to meet you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.